All right, everyone, it's noon, so we are going to go ahead and get started. Thank you for joining us for today's Spring into Health event. My name is Haven Spanier, and I'm the Senior Director of Programming at the University of South Carolina's Alumni Association, and it's my pleasure to get to introduce our host for today's event. Before we get started, I just want to give you all a few reminders. So we want this to be very interactive with lots of questions. So any questions that you have, you can type those either into the chat feature or into the Q&A. Either one will work for us. If you're not super familiar with Zoom, there should be a panel across the bottom of your screen. So if you hover your mouse down there, you should be able to click chat or Q&A, and we will be able to see your questions. We also want to give a big thank you to Prisma Health for making today's event possible. But without further ado, I'd love to introduce our host to you all today. Pattie graduated from the University of South Carolina School of Nursing in 1975. She immediately began working at Palmetto Health Richland, now a member of the Prisma Health system, and has been there ever since. During those first 24 years, she was a labor and delivery nurse where she served in various roles, including charge nurse, preceptor, and nurse manager. Pattie made the move from the floor to the administrative side of nursing in 2000. She became a nurse recruiter from 2000 to 2014. In 2014, she assumed her current role as the nursing engagement partner, where she tries to make sure that nurses are engaged and happy wherever they work within the Prisma system. Ms. Heady also always called Columbia home, but she now resides at Ocean Isle Beach, North Carolina. She still travels to Columbia or works remotely from the beach, where she spends her happy days with her family and 5 grandchildren. Thank you so much, Pattie, for joining us today. I know we're all really excited to hear from you.
Well, thank you so much. I'm thrilled to be here. Right now with all this COVID, and it's been exciting, it's been challenging. Been given a lot of COVID vaccines, so I've been working the Gamecock Clinic. So y'all can go with your questions, and I'll be glad to start answering them. Let me see if I can read them, Haven. Do we have questions? Anybody? What made you want to become a nurse? Is that right? Somebody wrote me?
Yes, ma'am.
Okay. Well, actually, the first time I saw a baby be born was my niece, and I switched my career from wanting to be a home ec major to want to be a nurse because I saw the miracle of a baby being born. And of course, I did work my first 24 years in labor and delivery, which I loved, and it was exciting and rewarding, but it was great. And nursing is a wonderful career. Nursing is about caring, and I think you have to have a heart of compassion and care to be a nurse. So that's it. So I love it. Like being out at the Gamecock Center and giving the vaccines, those people have been so kind and sweet and thankful to get all these vaccines. So it's been wonderful if any of y'all have come out there and worked. Do we have any other additional? Why did you want to work in labor and delivery? What made you stay in the area so long? So labor and delivery is a very exciting place, of course. It's an adrenaline rush. I think y'all understand, you are busy, you're on your feet, it's not a slow time, and things can turn easily. And I loved it. It was a great time. So, and I love working for Prisma. That's my biggest thing. And, I think it's the best place in the world to work. Now, let's see, what made you stay so long in that area? Oh, what made you want to switch to administrative role? So I actually, in 2000, I went to health for 6 weeks. I was told I was just going to help. The nurse recruiter was having surgery, and I went over there just to help recruit and hire nurses. And y'all, I fell in love with it. I realized that if you enjoy something, which that's what I think, you'll love it. And I went on a few recruiting trips to colleges and talked to nursing students about coming to work for, at the time, of course, with Pattie Health, that I loved it. And I just love talking to it. I'm very passionate about it. I'm passionate about, of course, USC, because that's where I graduated from. But the biggest thing is if you believe in something, you don't mind doing it. So I think it's a great place to work. You know, nursing is so diverse. You can be labor and delivery, you can be med surg, you can do critical care, you can be a case manager, home health, school nurse, pharmaceuticals. So there's lots of different things to do. Do I have another question and answer? Will they pop up there? What did you like most about being an administrative? What did you dislike? I miss the patient care. I miss being the bedside and administrative. That's the only thing. I really wish, and for about 4 years, I did continue to go back and help labor and delivery a little bit because it's in your blood. Of course, I'm a really old nurse now, so administrative, I love administrative. There's really nothing that I did not like about being in administration other than, you know, making sure everybody's covered and everything's done there. But as far as nursing, seeing patients' happiness, you know, patients, they just want to know you're kind and that you care. And most patients are scared because they don't know the outcomes. So that's one thing about nursing. Remember, it's customer service. It's how we treat people and we treat each other. So that's one thing we need to remember in nursing is if you are a nursing student, is that being kind is just the most important thing. You know, we want to treat people like we want to be treated. Let's see, what does a typical work day and work week look like for you? So for right now, I told you I'm a nursing engagement partner. So I round on nurses, I send them emails, I send out like 30, 60, 90, and 180s. Checking on them, seeing if there's anything they're struggling with. Maybe they need a job change. So I help a lot with recruitment, help find them a new job, something that will make them happy. Then, well, right now, what does my day work like, my week look like? So Monday, I worked at the COVID unit at the Gamecock Park. Tuesday, I did school vaccines for Richland County District 1. We have the mobile unit. We go around and anyone with symptoms of COVID, we do testing on students and teachers or faculty or administrative people. That's what I did on Tuesday. Then Wednesday, I went in and worked in my office and did office work. And then from 12 till 5, I did the COVID unit yesterday. And then today, and actually last night coming in the car driving back, I talked to 3 different nurses. One was a nursing student trying to help her decide what area she would like to go work in as she graduated. People just need to think there's so many different areas of nursing that you can decide on, whether it's med surg, critical care, labor and delivery, pediatrics. It's what you like. And I want you to be in a place that's going to make you happy. You know, remember, nursing is usually, if you work in the hospital, it's 24/7. So you have to remember might give up your weekends like every other weekend, or maybe you want to go do a clinic job where you just do Monday through Friday. It just depends on what you want and in your lifestyle. What were your day-to-day roles in labor and delivery and in an administrative role? Well, today, day to day in labor and delivery, of course, you had patients that came in and were in labor and we evaluated them, or maybe they came in for something else. They could have had an infection or thought their water broke or false labor. You send them home. We did all kind of testing. We did amniocentesis. We did ultrasounds. And of course, when I was manager, was running the unit, ordering the supplies, timesheets, evaluations of staff, making sure the place was clean, that everyone was up to date on their all their duties. So nursing, you have to keep all your skills up. What advice would you give high school students who are interested in a career in healthcare? I would tell them, of course, any science, anatomy, physiology, anything like that. The main thing for nursing is if you have to have a love for people and patients, and as long as you have good customer service, you would be a great nurse. I tell them to get good grades. Grades are very important. You have to do well. Nursing is, whether you're a babysitter and taking care of children, then you need to know basic life skills, CPR. If you like and enjoy that and you're not afraid, then nursing would be a great avenue for you to take. What are the major differences between different types of nursing? Different types of nursing. I guess, you have OR nurses that do surgery. So maybe they do assist the physician in the operating room. So that's a type of nursing. Then you have basic med-surg nurse, which take care of, say, maybe 5 or 6 patients, and they have those for the entire 12-hour shifts. Then you have critical care nurses that do 1-on-1 or 1-to-2 when they have all the, the monitors and the IVs. That's a critical care nurse. Then you have women's who take care of those who are having childbearing. Then you have pediatric nurses that do peds. You have emergency room nurses. They have to be ready to think quick because they're in a maybe a trauma or just evaluating patients that come into the ED. Then you have, let's see, you have home health nurses that go take care of patients in the community that can't get out. Then we have nurses that are school nurses that take care of students. Then we have, I was trying to think, let's see, different types of nursing. You have teachers, instructors, faculty that teach nursing programs. Let's see. In my old age, let me think, what other kind of nurses? You have nurses that do charting, that do for insurance companies, that then you have nurses that look at records. You have nurses that take care of quality, that make sure we're doing everything right and everyone's safe, educators. So there's all types of nursing. Let's see, any other questions? I don't see any other questions. Let's see. What are the challenges of being a nurse? Challenges. I would say challenges are that, number one, you have to put others first. Challenges that you have to work long shifts. You can't just leave and go take care of somebody else. You're responsible for a patient. If you sign up for that 12-hour shift, you have to be there the whole time. It's just not like leave and go have lunch. You're there taking care of that patient unless you like leave and go have lunch. You have to make sure someone else is watching that patient for you. Nursing is very different. You have to work 24/7. I always tell people when they're thinking about nursing to remember, we never close down. If you work in a hospital, we're open 24/7. 7 days a week, 365 days a year. We never shut our doors. And even though a snowstorm comes, you still have to take care of those patients, and the responsibility is great, and it's something that you have to want to do to be a nurse. Right now, nursing, we're short nurses with all this COVID going on. You know, nursing, a lot of nurses and a lot of my friends have come out of retirement to help us out there at Gamecock Park and the other areas around town to give these vaccines. So let's see, what are the challenges of nursing, of being a nurse? It's just, you know, nursing is difficult. You have to put yourself on the back burner and put that patient on the front. You have to show compassion and care. And you may be tired or hungry, but you got to take care of that patient and meet that patient's needs without thinking about yourself. It says, what would you like to see change in the field of nursing? For me, I would probably like to see more nurses do bedside. I tend to think that nurses rush into, and this is just my personal opinion now, I believe that they ought to be at the bedside and learn to take care of patients first. I wish that everyone would rotate through, say, med surg or on the floor and learn how to take care of patients before moving on to do other fields. I wish they had more of a background. That's for me. I never did med surg until later in life. I actually went and worked on an OBGYN floor. I wished I had done that first. I wish my foundation would have been a little better. And by foundation, I mean learn to take care of those 5 to 6 patients first and illnesses. And, you know, because working and going straight to labor and delivery, that's pretty much my life. I don't think I could go do a floor nursing. Changes with nursing, I wish people put them up higher. I mean, I think nurses are very important in our life, and I know that right now they're our heroes. It's taken a long time for us to become heroes, but you know, we are kind of the backbone of the healthcare system. We go way, way back. I mean, that's me. What would I like to see change in the field of nursing? Probably that we did more patient care. You know, right now, sometimes critical care nurses go in and they learn to take care of they look at the machines and we forget about the patients sometimes. What experiences would you advise nursing students to get during school to prepare for their career, internships, and summer jobs? I do think that nursing students, I wish they worked a little bit in the hospital. I think that's the best thing. I was a student nurse for a year before I graduated nursing school. I think that's a wonderful thing. It really puts you in the right there and you see what goes on. I want you to be there and experience as a tech or a student nurse tech. I think that nurses ought to do that. Maybe not a lot. I think if they did maybe one shift every 2 weeks or one shift a week, or we don't require much, but we do love to have nursing students come and work. They're such an asset to us. And I think they learn what they want to do and how to take care of the patient. You know, nursing, it's a group. It takes physicians and techs and radiologists and ultrasound people take such a group of people to take care of patients. I wish nursing students would all come and maybe be a tech or a student nurse tech on the floor. I think we have the extern program at Prisma Health, which there'll be, I think, probably 20 in the Midlands and 20 in the upstate that'll be chosen for a 10-week course. I think it's either 8 or 10 weeks this summer, and they get paid and they'll follow a nurse and precept her. I think that that is a good program and an excellent program. You know, remember, there's nurses that do pediatrics and hearts, and there's just everything you'd ever want to do. I think that, you know, sometimes the real world of working at night and every other weekend, people graduate and get out of school and they're like, oh my goodness, but I think it's the best job ever. It is just so rewarding to take care of and make people feel better, or if you can't make them better, at least you make their comfort better. I think that's the importance. I just got another question. It says, what qualities make a good nurse? All right, let me think. I would probably say caring and compassion, integrity, kindness, gentleness. I'm kind of loud and out there, and I have to remember to keep myself quiet. Excuse me. Sometimes because I can be over the top. But, you know, holding somebody's hand and being gentle, or maybe just touching them, which we don't get to do a lot right now with COVID, just letting people know that you care. Compassion, willingness to work. You know, nursing is different. You know, we have to be, you know, we have to give injections and we have to take care of things. You kind of got to be a little almost thick-skinned, I think. But then you have to be kind and gentle and loving. And nursing is kind of different. Now we wear scrubs. You know, when I went to nursing school, you know, you were white and you were crisp, and people don't want to wear white now and white nursing uniforms. So it's really kind of different. But I mean, I've seen you know, I'm 65 years old. I've seen nursing, wow, change over the years, and things are so much better than they were. So we've kind of come a long way, but it's a great field. Here's the question. What advice do you have for anyone already working a full-time job who may be thinking about a career change to nursing? I think it's good. I think you got to make sure you know what you're doing. Nursing it's difficult. For those that are a nurse, it's a lot to learn. It's not an easy road. It's not, you got to learn drugs and the body. You ask any nursing student, it's tough. Nursing, if you graduate from nursing school, you've done well. If you're looking to change and become a nurse, just remember, I mean, you got to love what you do. You got to, yes, you get to wear uniforms and scrubs, but it's tough out there, and I think it's the best career ever. What major changes have you seen in your career? Probably major changes. Now everyone is into becoming nurse practitioners or going on with their degree. Lots are getting their masters, which is wonderful. Don't get me wrong, it's wonderful. When I came along, you know, we were saving money to buy a new refrigerator when I was young and got out of nursing school. Nowadays, people want something, they just go buy it. We're in a different era, I think. You know, I worked and you would pick up extra shifts if you wanted to go on vacation, and you worked extra to have things. Things now are totally different. You know, when I was young and a new mom, and it was great for me, y'all, I want to tell you, it was the best job because probably for 10 straight years, I worked nights when my children were in middle and high school so that I didn't miss any events that they were in, so I could go to everything. So I did night shift at least for 10 years because I didn't want to miss their events. Said, did you ever work the night shift? If so, what was it like? I love night shift. So in labor and delivery, I did 11P to 11A. Now, y'all, I did come in at 11 o'clock and I stayed till 11:30 the next day. The reason I did this was because in labor and delivery, a lot of your inductions were done in the morning. And I would stay to get those going, and then at 11:30 leave. And I picked up my youngest child from kindergarten at 12. And I would come home, feed her lunch, take a nap. My children got off the bus or either carpool drop them off, see them, get them to do homework, and then I would go back to sleep. I might wake up for supper. So I did some sleeping, and, you know, I'm a kind of the person that could sleep for 2 or 3 hours, then get up and then do something, run them to practice, come back, take a nap. But I, you know, and then I could go to ball games or take them to cheerleading. So it was a great career for me then. And, you know, maybe I was half asleep or something like that, but I love night shift. It said, what would you recommend to foreign people who want to start or have nursing knowledge in the ladder of nursing? So I have worked with lots of people from other countries, and usually what they have to do is either take the NCLEX or maybe some refresher courses. And I think that's offered to a lot of places. So they come in, great people, they have great knowledge, they just have to learn what we do here in this country. So, you know, please give me some feedback, call me. I think my contact's on there. I'll be glad to help you or hook you up to who you need. If you, because I know in other countries, your license is different. So either you have to retake the NCLEX and maybe you have to study. I think that's with the Board of Nursing, what qualifies you, but I'll be glad to help you or direct you in that right path. It says, have you seen changes or problems in our national healthcare system to reflect in your work, affecting you, coworkers, and patients? Documentation. You know, I'm from the era before computers where we had to handwrite everything. Like, you know, you wrote, patient arrived via wheelchair, alert and oriented ×3, where now you click, 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 click on the computer. Everything is computer. And, you know, I learned if you didn't chart it, it wasn't done. And I think that's just still the same way. Healthcare, problems in our national healthcare. I don't know that I know of problems in our national healthcare system. is it reflected in your work, affecting you? And not really, I don't think, other than now you have to chart everything. I mean, everything is chart, but it's kind of even wonderful. I mean, even at the COVID vaccines, Prisma is going to Epic, and I learned to chart in Epic doing the vaccines, and that's great. And you see everything. It's just so different. You can just look and see. I think it's for the better computer. Everything's at your fingertips, and you can look and see what labs were done and what values were done. So I think that's better. I hope I answered. I don't know that engagement, I'm a nurse and engagement partner. So I told you I round on nurses and check on them and make sure they're happy. Because, if people aren't happy in their job, then they don't do a good job. And I think I'm all about working with people you like. I want people to interview and work together, because I think friends, if that's your work people, I think you'll love who you work with. So I think we're pretty good. Let's see. Here's another question. What leads to burnout in nurses, and how can you avoid this? I think what leads to burnout is nurses working so much. I talked to someone the other day who had worked since, what did she tell me? Let's see. She had worked the past 8 months and had not had a day off, either testing or doing vaccines. I think that leads to burnout. Nurses tend to, pick up extra shifts, help, and that leads to it, that you just overwork. Because remember, like I told you, if you're on the floor working, you can't go home till you're done charting until you're complete and your task is complete and your patient's taken care of. So it leads, plus y'all, you have to remember, as nurses, we worry. You go home and say, did I do everything? Did I do everything's right? Yesterday, just even at the vaccine clinic, I had to go back and double check something because I kind of had a brain thing where all of a sudden I was like, did I chart that right? And I had to go back and look. And that's how nurses are. They want to make sure everything's done. All your T's are crossed and your I's are dotted. So that's, to me, I think that just nursing overworked and overworked and under, I want to say paid, but yeah. What is your favorite part for working for Prisma? Oh, y'all, I love Prisma. I just think it's the best hospital facility. It's the only place I've ever worked. So I was going to tell you about myself. I have been at Prisma. I started in 1974 as a student nurse tech for a year in labor and delivery. And I just think it's a family. It's people that care about you. I think it's the best facility. Trauma is great. Labor and delivery is great. Pediatrics, we have Children's Hospital. Our behavioral health is great. Our med surg. Remember, Prisma has so many eyes looking at you. I tell people I was born at the Baptist. And I think that's wonderful. Born there, started working on the Richland campus. Park Ridge is phenomenal. It's just the best place to work. I left for 7 years to work at a family store when my father was real sick. And once he passed away, I came right back to Prisma. I could really shoot myself that I didn't stay for those 7 years and work at least one day a week or one day a month, PRN, just to keep my foot in the door. And then I would have been there a really, really long time. But I had my 3 children and worked at the family business then, and came right back. So I just think everybody cares about everybody. On the Richland team, at the Richland campus, you know, you have the medical students, so they're there learning and studying, and that's really different. You know, you have to remember when that physician comes in, he's probably going to have somebody with him. I went yesterday to the orthopedic, and he had a med student with him, and watching him learn and teach is very fascinating. You got to like that. But I didn't mind at all. I had more eyes looking at me and, you know, telling me that I have arthritis. So something like you don't want to hear. But anyway, that's just me. But I do think Prisma Health is the best place to work. We just have so many opportunities. And y'all, we have the upstate now. So we have the Greenville area and we have the Midlands, and you can transfer between the two and your growth. We have the opportunities for career advancement is just fabulous. It's wonderful. You can go from department to department. What advice do you have for anyone applying to nursing jobs, application or interview tips? Oh, y'all, so I have to tell y'all, last night I was listening to a podcast coming in the car about interview tips. And my coworker called me this morning about it, and we were sharing. One thing for interview tips: never ask, what am I going to get paid? Not at the first. Never should it be in the first interview time should you ask, what will my starting salary be? That is just a no-no. And this wasn't even talking about nursing. It was just careers in general. But you should never ask, what is your salary going to be? Because we hope you're coming to work for the job and not for just the money. Advice to tell you on interviews: dress for success. So I used to tell people when I'd go out and do some interview skills and resume writing is dress. You know, remember who you are. You know, just dress for success. I don't want to tell you to put on, you know, what to wear and all. Don't show up with gum in your mouth. Put your cell phone not even on vibrate. Leave it in the car. I don't want you to carry I've had people carry a Mountain Dew bottle in their hand, or their sunglasses, you know, pushed up on their head like this. And you want to say, okay, come on, don't. Be professional. Remember who you are. Remember who you represent, and you're there to be the best. You want to be the best for your job. You want to do a resume. I had to tell someone the other day they had a 5-page resume. Your resume should be no more than 1 to 2 pages, never 5 pages. And about jobs, y'all, don't job hop. When you're a recruiter and you look out there and somebody is only staying in a job 6 months, I tell people 1 year to 2 years is the minimum you ought to be in a job. Now, that's my personal opinion, but I think that you should stay in a job and at least give it some try. Do you know that I think to give orientation to a nurse costs somewhere around $40,000 to $50,000? So I want to tell you, if we put that much money in, that's why I'm here. If you don't like your job, I'd rather find you something else within the system so that you don't have to go through orientation again. But anyone applying to nursing jobs, advice: call me. I'll help you. My cell phone's on there, or my email's on there. I'll be glad to help you. If you're not hearing, I will gladly help you reach out and give you some advice. Even though CNAs are in so much demand, why do you think it's so hard to get classes or real certifications? I don't know. Now, you know, I know around town, are they not some certifications you can take that are around 6 weeks or $500, I thought. And maybe I might need to bring it to Prisma Health as we run our own CNA class. that might be something we could think about or talk to or suggest. I know that if you are in nursing school and you completed your first fundamentals of nursing, then you're qualified to be a student nurse tech. I hope that answers the question. But we love CNAs, and y'all, CNAs, or we call them patient care techs, they work so hard, and it is a very hard job to do. It is difficult, and I feel for them. And like I said, that's what I was a student nurse tech. So hopefully we can get some more in. All right, here's another one. What has it been like working at the COVID-19 vaccination sites? Like I said, I have worked Park Ridge Baptist and the Gamecock Center. The only one that I have not worked is the Richland campus. I even worked last Saturday at Weber Elementary. We took the mobile unit down there and did some vaccines. It's just been the most wonderful thing. Usually, like at the mobile center, we had the National Guard there helping us. And it was funny. We didn't have internet when we first got there, so they were paper charting, and I was like, I could do the paper charting. So I charted, and they did all the vaccines and got up and down and did all that. But it's wonderful. People are so appreciative. If you haven't been there and worked or volunteered, it's very rewarding. So hopefully we can get out of these times right now. But it's something to think about. It's great. It is great. Everybody's been kind and friendly. And now we'll tell you, it's been a little cold. Last week when it was 41 degrees, or even last Saturday when it was 28, when we got down to Eastover, it was a little chilly for me, and my hands didn't want to work quite as well. But the cold, this past Monday, I worked the Gamecock Center, and it was raining, and the rain was blowing in on those tents. And, you know, people drive through the tents, and you had to walk out in the element and the rain to give them their vaccines. So I'd walk out there and give them their vaccines, and I'd run around to the other side of the car to lean in to talk to them, to tell them, you know, signs and symptoms, what to look for and where to go park, and to give them their little cards. So yes, it's been interesting. But for this old lady, I have surely enjoyed it. The weather's a little something to be desired, which we can't help. But if it's cold and rainy, it's been trying, but I still love it. But all right, I was looking for a question. Are we done? Oh, there you go.
We got through a lot of the questions, but if anyone has more, please keep them coming.
I'm here
today. But I do want to thank everyone for joining us for today's event. I know I learned so much about the nursing field. I'm obviously in a very different field than that, so it's very fascinating to learn, as well as stuff with COVID going on. So thank you so much, Pattie, for your time today. We really appreciate it. And thank you everyone for joining us. I hope we got all of your questions answered. And like Pattie said, her contact info is in the top of the chat. So if you have further questions for her, go ahead and make sure you take note of that so you can reach out to her. But it looks like that was everyone's question. So thank you.
All right. Well, thank you.
Hope everyone has a wonderful afternoon.